Good evening, I'm Stone Grissom, and welcome to our live coronavirus pandemic special report. Tonight, we have a doctor from Long Island Jewish Medical Center to help you sort through what's going on with COVID-19 in our communities and across the region. And we want to hear from you. This is a call-in show, so call us at the number right there at the bottom of your screen, 516-393-1800. Well, the New York City subways will be shut down for 4 hours each night for disinfecting to keep essential workers safe. Today, Governor Cuomo announced service will be halted from 1 to 5 in the morning. That will start next Wednesday. Now, he says buses, vans, and for hire cars, those will be used to transport the essential workers during those hours. No cost to the workers. He says service on the LIRR, that will not be disrupted. And while the number of new cases being diagnosed is slightly down, the governor says the number is still, and he's right, unacceptable. Statewide, we have reached a new milestone of more than 300,000 cases. Just imagine that. That's since the end of February. Although both of Long Island County executives say that we are on course to enter phase 1 of reopening, more than 70,000 people across the island have been infected with the deadly virus since the outbreak began. Now, deaths and hospitalizations from COVID-19, they are down across New York, but the governor says the human cost is still too high. Look at the numbers. More than 18,000 New Yorkers have lost their lives as a result of the pandemic. 2,800 of those victims are from Nassau and Suffolk. All right, let's get right now to our discussion. Joining us tonight, Dr. Nancy Kwon, the Vice Chair of Emergency Medicine at Long Island Jewish Medical Center, joining us remotely. Appreciate your time. Thank you so much for everything that you're doing. You're one of the heroes. We thank you and everybody else. So let me start off as I ask everyone, how are you doing? How are you holding up?
Thank you so much for having me. First of all, I think we're holding up pretty well. It's definitely been a very difficult and challenging time, but the cases, at least for the emergency department, have decreased, and I think the curve has flattened a little bit through all the efforts of New York and of the country.
Now, are the numbers that you're seeing, I mean, you're on the front lines, are the numbers you're seeing as advertised as we're hearing from the county executives and from the governor?
Yes, we've definitely seen a significant decrease in the number of COVID cases presenting to the emergency department. And I think the other thing that we are seeing is an increase of the other cases, patients who are not presenting with COVID, which in many ways we are happy about, because we were worried about the patients with their chronic medical diseases, how they were getting care.
Okay. Let's go straight to the phones right now, and I think Betty is on the line right now. Betty, you there?
Yes, I am.
Thanks for calling, and what's your question?
Thank you for having me call. My question is I was in the hospital beginning of January for 2 days. They told me I had the flu, sent me home. 2 days later, I was back in the hospital because I couldn't breathe, had the severe cough, the whole 9 yards. Everything COVID is what I had. However, they kept saying it was an infection and respiratory problem, as well as flu. Now, what I'd like to know is, how do I go about getting tested to see if I did have COVID-19?
Doctor, do you know the availability of testing? Because I know you can contact the different counties, and there are testing sites that people can go to, but how about at your hospital?
There is, and I think that's a great question. I think one question I would have for you is, when did you present to the hospital, and when were your symptoms? At the time that you had your disease, we could have tested you for COVID. Now that it sounds like you're in the recovery phase, there is going to be testing that is opening up and becoming more widespread for antibodies. So that may suggest that you were infected previously with COVID.
And we don't know yet, I mean, still too early, right, doctor, that whether if you do have the antibodies in your body, whether you are immune for getting it twice, right?
Yes, I think we have to learn more about what the antibody testing means. So whether you have the antibodies, what the level is, it's still unclear whether that means immunity and for how long, and whether you can get it again. So I think more research just needs to be done regarding that.
Okay. Let's go to, okay, I'm going to try to say, is it Gunter or is it Gunter?
It's Gunter.
Gunter, yeah. Okay. Southampton, thanks for calling. What's your question?
Yeah, my concern is over the developing new vaccine for COVID-19. How do we know that it won't induce, a hypersensitive reaction to the virus, just as what happened in 2003 with SARS-1, where it was warned against going forward with humans? How do we know that won't happen now?
And I think that's a great question. I think that the researchers are testing it in a very safe environment and in a controlled setting, and the vaccine would not be available widespread until the safety testing has been performed. That is why it's not available right now. They are doing some clinical trials, I believe, with the vaccine, but they predict as long as a year to 18 months, but hopefully by January is what Dr. Fauci has said.
Now, I know that there are sort of clinical trials, and I think even at LIJ there's some clinical trials with remdesivir, but that's something that's a treatment, not for the vaccine, right?
Yes, so that's a treatment for people who have contracted COVID. It's an antiviral agent, and some of the initial results have been promising, but we don't have the study finalized yet. So I think it is good news that there are some initial promising results.
Okay. Let's go to Donna from East Quogue. Donna?
Hello, how are you?
I'm great. What's your question tonight?
I have a question about COVID-19 and the same symptoms, or showing some of the same symptoms as high altitude sickness. And I read an article about Diamox.
Are you asking if people can take high altitude sickness medication?
Right. Can this Diamox be taken to help them? Because I also read about ventilators putting too much pressure into patients' lungs that are like someone with high altitude sickness and overpowering the lungs from being intubated and on it.
Doctor?
So Diamox is a treatment for high altitude sickness. It is a great question. It is not a treatment for COVID. With regards to the ventilators, certainly the ventilator settings have to be very carefully done with regards to the COVID patients, and sometimes they require some higher pressures. And this is obviously done in an ICU setting when patients are on a ventilator and a carefully monitored setting. So that's a great question.
Okay. And should people be experimenting? Because I know the symptoms of COVID-19 are really kind of all over the place. Should people be just experimenting with medications that treat the symptoms for maybe other ailments to try to treat COVID-19?
I don't think that they should be experimenting with other medications unless there's been proven efficacy with these medications. Certainly, there are medications that if you take and there hasn't been proven efficacy, that they could cause harm or cause danger to the person. So certainly, the research is immensely important, and luckily, we have a lot of really intelligent, great researchers who are fast-tracking the research so that we could get some answers regarding the treatments for this disease.
Okay. Let's go to Baca. Are you there?
I have another question, just a follow-up question. What happens?
I'm sorry, Baca. Say that again.
I'm here.
Oh,
how you doing?
Well, there was a follow-up question. I'm sorry, I didn't catch that follow-up question from. Was that from? Okay, I'm sorry, we lost her there. Baca, you're there on the line though, right?
I'm here. Thank you.
Thanks for calling. And what's your question?
I recently tested positive for the Quest antibody test, but my wife came back negative. Just wondering, is the reason why my wife didn't get the virus because I did not show any symptoms? And secondly, how reliable is the Quest antibody test?
That's a great question. In terms of why your wife did not get it, the transmission rates are variable, and there are some risk factors associated with COVID. So sometimes it's not known why somebody who's very healthy gets COVID versus another person who doesn't get it. We do know the transmission rate can be as much as 2 to even higher, that every one person can affect up to 2 and maybe even more patients. With regard to the antibody testing, all the tests, there are many different tests available to test COVID, and the sensitivity and specificity of these tests are variable. So That's a great question. So sometimes if the test comes back as negative, but the suspicion is high, it is very possible that the person still has COVID, and oftentimes we retest the patient.
Okay, we're going to take a real quick break, and when we come back, we're going to have more expert advice on how to keep you and your family safe from the coronavirus. And remember, we want to hear from you. Call us at that number right there at the bottom of your screen. We'll be right back. Welcome back to our live coronavirus pandemic special report. Let's bring back in Dr. Nancy Kwon, the Vice Chair of Emergency Medicine at Long Island Jewish Medical Center. I was about to ask you a question when we came back from break, but I think Linda has the same question. So Linda from Elmont, are you on the line?
Yes, I am.
What's your question tonight?
Okay, I'm scheduled for surgery in Winter Hospital on May 11th for knee replacement. Is it going to be safe to go to the hospital to get it done?
Yes, I think one of the things that all the hospitals have been planning is we've learned so much when the COVID pandemic was at its height, and we've learned how to organize our hospital into COVID zones versus non-COVID zones. There are people who do need their medical care, they need their surgeries, they need to be seen for things other than COVID, and we are concerned about these patients. We want to see them back. We don't want to see people sick or get sicker because they are not seeking medical care. It will be safe to come to the hospital for these surgeries. We will make it safe. It will be safe to come to the emergency department, and we want to take care of our communities.
Now, doctor, have you, in your hospital, have you opened it up for elective surgeries at this point? I know we call elective surgeries, but some of them are pretty big and important surgeries.
It hasn't quite been open yet, but the plan is to open it up very shortly. Right now, they have a number of different phases. The phase right now is definitely in emergency surgeries and urgent surgeries that need to be performed, but very soon we will be opening it up to elective surgeries as well.
Okay. Let's go back to the phone lines. Ellie, are you there?
Yes, I am. Hello.
Hello. What's your question tonight?
My question is, my husband and I were both diagnosed with corona on April 3rd. And we've been, basically I've been staying in the house for longer than he has because his symptoms seem to be mostly gone and I'm still having a little leftover. So my question is there anything I'm supposed to do to clean my house so that I can make sure it's sanitized enough for my 89-year-old father to come visit for my 10-month-old grandson to come visit at some point in some future time?
Doctor, how would you advise someone yeah.
That's a great question. I think, as everybody knows, we are very concerned about our elderly patient population, our elderly family members. And just like in the hospital where we do sanitize, we do extra cleaning, I think it would be important to do that because patients can be asymptomatic and have COVID. So in terms of cleaning products, Lysol, things with greater than 60% alcohol, I think are helpful. We do know that COVID can stay in the air for a few hours. It can stay on hard surfaces for even days. So I think thorough cleaning can be very helpful if you're going to see family members. And I would still say to maintain the social distancing as much as possible. I think we need to maintain that because we don't have enough answers about the disease yet. And it is very clear that the social distancing has flattened the curve.
Yeah. Thank you, Ellie, for calling, and stay safe. I hope you and your husband stay safe. Let's go to Gina. Are you there?
Yes. Hi.
Hi. What's your question tonight?
My question is, if I get the antibody test and I test negative or I test positive, I understand that I can still transmit the disease and I can still catch the disease. So I'm not sure what the purpose of having that test done is.
So I think that's a great question. I think that's a question many of us have. We do need more answers regarding the antibody test. If the antibody test comes back as positive or shows that you have antibodies, at some point it means that you were exposed and or had the disease, whether you were symptomatic or not. I think, that there probably is evidence that it confers some protection. We just don't know what yet and how long that lasts for. I think if the antibody testing, we are trying to promote it and expand it to other people, because if there's potential that people are immune, it could mean something with regards to opening up the economy more, for that maybe there will be less spread of the disease. But we don't have all the answers yet. It's a great question.
And if you do have the antibodies, you might be eligible for giving blood, which can be used for the convalescent plasma, right?
Yes.
Yeah, that would be good. So are you fearful? I mean, how common would these types of viruses to have a second wave? I mean, we're coming in when we go into fall.
I think that's a concern of everybody, that if it is seasonal, when we go into fall, that we will see a resurgence of the disease. And I think if there's social distancing is reduced, that there also could be a second wave.
Yeah.
I think what we fear is that COVID will come back at the same time as flu.
Yeah.
And that would be very difficult, but we have been prepared.
Unfortunately, we're running right out of time, and I apologize for that. Dr. Kwon, thank you so much for everything you do, and thank you, our viewers. We'll see you tomorrow night.
Thank you so much for having me.